This is the patient education video series, and my today video is about the dengue fever. So, what is dengue fever? What are the symptoms of dengue fever? Should I see a doctor or nurse? Is there a test for the dengue fever? How is dengue fever treated? Is there anything I can do on my own to feel better? Can dengue fever be prevented? These are certain questions which need answers. So, what is a dengue fever? Dengue fever is an infection caused by one of the four viruses called the dengue viruses. They are related to each other, but they are not exactly the same. Getting sick from one dengue virus does not protect you from getting the others. A person can get dengue fever more than once. Dengue fever is spread by the mosquitoes that carry dengue viruses. People who live in the areas where these mosquitoes are common have the highest risk of infection. These areas include Asia, America, and Caribbean. What are the symptoms of dengue fever? Symptoms usually happen 4 to 7 days after a bite from a mosquito that carries the dengue virus, but they can happen up to 2 weeks later. Symptoms usually last 5 to 7 days, and the dengue fever symptoms are different for each person. They can be mild or severe, include fever, headache, pain behind the eyes, joint and muscle pain, feeling tired, sometimes for days to weeks, and a rash. The skin will flayed or have small bumps. It might be itchy. A rash is more common in people who have not been infected with the dengue virus before. Stomach problems such as nausea, vomiting, and diarrhea, cup, sore throat, and stuffy nose, small purple spots on the skin, red eyes, and swollen glands. Children and younger people often have less severe symptoms. People who had dengue fever in the past and get infected with a different dengue virus have highest risk of severe symptoms. A person with severe dengue fever might have a bad belly pain, get bruises without bumping into anything, vomit blood, get nosebleeds, have black bowel movements, have seizures, have bleeding between menses in females. Should I see a doctor or nurse? Yes. If you live in a country where dengue fever is common, see a doctor or nurse if you have any of these symptoms. If you used to live in a country where dengue fever is common, recently went back for a visit, see a doctor or nurse if you have symptoms of a dengue fever. Is there a test for the dengue fever? Yes. A doctor might be able to tell if you have a dengue fever by doing an exam and learning about the symptoms. They can also do blood tests, and these tests can show if you have a dengue fever or another disease that causes the similar symptoms such as the Zika virus infection. In countries where dengue fever is common, you might not get a blood test, but doctors can still treat the symptoms if they think that you have it. How is dengue fever treated? There is no treatment for the virus that causes the dengue fever, but doctors can treat the symptoms. Very sick people can be treated in the hospital, and treatments include blood transfusions, getting fluids through IV cannula. Some people are getting sicker from the dengue fever than other people, and those people are pregnant people, babies, older people, people with obesity, and people who have diabetes, like diabetes, kidney failure, and certain blood diseases. These people might need to go to the hospital if they get dengue fever. Doctors can watch for severe symptoms and treat them if they happen. People who are not as sick can usually rest at home. If you have a dengue fever, you might need to see a doctor, a nurse every day until you get better. The doctor or nurse can do blood tests and check your blood pressure, and these are very important. Is there anything I can do on my own to feel better? Yes. If the doctor says that you do not need to go to the hospital, you can stay home, rest, and drink plenty of fluids. You can also take acetaminophen, which relieve your fever and aches. Do not take aspirin or NSAIDs such as ibuprofen, naproxen. These drugs can increase the risk of bleeding in people with dengue fever. Never give aspirin or medicine that contain aspirin to children younger than 18 years, In children, aspirin can cause a serious problem called Reye syndrome. Can dengue fever be prevented? Yes. The best way to prevent the dengue fever is to avoid the mosquitoes that carry it. Not all countries where dengue fever is common control the mosquitoes well, but you can lower your chances of getting dengue fever if you live or travel there. You can stay inside during the day when the mosquitoes that carry the dengue fever are most active. Wear shoes, long sleeve shirts, long pants, and a hat when you go outside. Wear bug spray or cream that contain DEET or a chemical called ficardin. Check the label to make sure. Do not use DEET on babies younger than 2 months. On your clothes and gear, use bug repellents that have a chemical called permethrin. Drain any standing water near your home, such as wedding pools, buckets, potted plants. Mosquitoes breed on standing water. A vaccine for the dengue fever is available in some parts of the world, but not everyone is eligible for the vaccine. So ask your doctor if you want to learn more about that. Thanks.